Hello, friends. Welcome to Akulmach Live. My name is Chandrakant. And you know that the entire world is reeling over the pandemic, and there are so many patients. The hospitals are overrun by patients. Uh, there are more patients, and there are less doctors. And because of that, there could be some communication gaps between doctors and patient. So, this is exactly what we want to discuss. How do doctors or patient improve their communication skills while everyone under pressure? Before we start our discussion, a word on our giveaway. We have some unique Akulmach memorabilia which will make you look outstanding. The graphics on these corporate gifts are based on the global best business practices. To become recipient of one of these gifts for free, you have to watch this video till the end and provide your valuable comments. Or you can also share your experiences. The person who makes the best comment would be chosen to become a recipient of this beautiful Akulmak gift, absolutely free, delivered to your doorsteps. The winner would also get a chance to be invited live as a distinguished panelist during our next video. What are you waiting for, friends? Please subscribe Akulmak and smash that like button. Now, let's get back to our discussion. Hello, friends. Let me introduce our guest today. She's joining us from London. Her name is Dr. Neha Sharma. She is very popular. She is also a beauty pageant. And today we would like to discuss about the role of smart communication, specifically between doctors and patient. So, without further ado, let me present Dr. Neha to you.
Hi, CK. Thank you so much for inviting me here. And I'm very excited to speak about how to be an effective communicator, and which is a key for any healthcare professional. And I think this topic is very close to my heart because of the obvious concern which we see on a regular basis on the social media, how much it has impacted, like how much to what extent the doctor and the patient relationship has been impacted. And somewhere I feel that this is a very hot topic, like how we can improve those things. And I feel like that communication is one of the key, which if it is being improved from both the patient side as well as from a doctor's side, then a lot of things can be prevented. So that's the whole idea of talking to you today about how to be an effective communicator.
Well, Neha, actually, the issue here is that, especially now when there is so much pressure on the medical system and a lot of patients are reaching the hospital, doctors usually are very polite. You know, they understand the problems of the patient, they listen to them very politely and give solution. But right now, I think everybody is so much stressed. So my question would be how doctors must still stay calm, maintain their cool, and respond to the patient in a proper way. You have any tips, guidance for the doctors?
Definitely, CK. I think the most important thing at this current moment is like this global pandemic has hit everyone equally. No, it's just not the common, the layman or the common population. It's equally very challenging and very traumatizing experience for the entire medical fraternity. And currently, if you see the situation, many doctors, many nurses, many healthcare professionals, or the key workers, they have died serving the patient, and it is very challenging time to meet the expectation of the family when we know that situation is really very badly hit. Even in India, we can see that complete medical fraternity is right now in a situation where they're struggling. And obviously, the expectation of the patient and the family is also very high because they are concerned about their near and dear one. At the same time, there are medical concerns, there are need for hospitalization, there is need for more strict observation in the hospital. But at the same time, it's really difficult because we are running out of the resources. We are massively in manpower crisis. A lot of doctors and nurses, they're isolating as well at the same time. And those who are working on a regular basis, like, in order to cover the shift for their colleague as well, it's equally very difficult for them. So my most key or important advice for any of the healthcare professionals or even to the patient is try to be a good listener. And that is a key to be an effective communicator. And what I mean is that unless until we are proactive in terms of active listening, we can't be a very good or effective communicator. Only once we know how the person in front feels about his or her current condition, or about his or her relative who is being brought to the hospital or to the doctor, unless until we know their genuine concern, unless until we have a habit of actively listening about their feeling, we can't give them comfort and we can't give them any further advice or suggestion which can make any change in their life. So I think the first key important thing is to be an active listener.
Well, Nehaji, the issue is that if there are many patients together and everybody's life is important and everybody needs to be saved, so the doctors are getting a lot of pressure from all sides, the lack of medicines, the lack of working staff, and more number of patients. So, what is that, they should do? But after all, end of the day, they're all human beings. They get distracted, and while your advice is to be a good listener, but I think when there are so many things happening together at the same time, how the doctors must train themselves to cope up with this situation.
I think CK, like one of the key fundamental thing for the doctors is like obviously you have to listen, you have to be empathetic, you have to build up that rapport and trust when you're talking to the patient. You are very right in saying it is difficult, specifically if that same kind of thing is not there from the patient side or the relative side, because you can see everybody is impatient. Everybody want the treatment to happen proactive, like very quickly. They want the result. They want everything to know, but it isn't something a rocket science. It takes time even to know exactly what are the condition, what are the cause behind this suffering, or why this patient is brought here, whether it is COVID positive or is it a COVID negative with some other comorbid condition. It takes time to come up to that conclusion that this is the diagnosis and this is the treatment for that. I think right now the major issue is nobody has got patience, and that is the main thing which actually puts this doctor and patient relationship into more vulnerable situation. And I think it has to develop from both the side. We have to have a patience. At the same time, I think when a lot of people are coming at the same time and they all are talking, obviously we have to take a step back and we have to request them, see, this doesn't make any sense to us. We need to understand, but let's sit down together. Let's listen what is happening right now. Let's have an on table discussion about what's happening right now. What are the things and possible differential diagnosis here, like for the patient, and what will be our strategy to address this current condition. So I think it has to be in that way, but that will only come up when we have a mutual trust and when we are ready to listen to each other and to make a concrete plan in order to benefit our patient. But that has to be from the both the parties. It's not just something from the doctor's end, it has to be from the patient end as well.
Well, Neha, this is something like a crisis situation, and suddenly it has extrapolated, or I would say exponentially aggravated, and nobody is prepared for this. Doctors are not prepared for it. Patients are never having a lot of patience as we speak, but I think there is no time for training. There is no time to learn. There is no time to waste, and it's a matter of life and death. So in such a situation, I think the communication is very, very critical. But I know I've been to hospital recently for my parents, and I've seen the doctor being so calm, cool all the time. Patients will say whatever they want to say. They will vent out on the doctor. Doctor will not react. But now, for past 10 days, I am seeing a different, totally different attitude from the doctors, and there is no time for training. So how, what is your two letter mantra for the doctors they should follow?
I think it's very hard for me to say, CK, because the situation is quite individual, like it's quite different in each scenario. I think it is a very challenging situation for everyone, and everyone is human being, and it's just not about patient being feeling like vulnerable and in a situation where the things are completely out of control. Even as a healthcare professional, at this current situation, we feel being helpless as well because we wanted to help the patient, we wanted to save their lives, but many things are not in our hand. We are trying our best, but at the same time it is impacting us, it is impacting our mental well-being as well. And even like it's not something easy for us to have every day facing this thing for last 1 year and still being very positive in our attitude, still being very calm and composed. It is something which is like very, very draining kind of experience for everyone. But at the same time, the things which helped me, CK, which I'm saying on my personal experience, like I don't know about the other my other colleagues, but the thing which has helped me is, um, I do regular meditations and yoga. I do regular exercise, and I do listen to spiritual leaders on a regular basis. For me, like I hear BK Shivani ji on a regular basis, Gaur Gopal Das ji on a regular basis, Sadhguru on a regular basis. And these three people, apart from my parents and some of my very close mentors, these are the people with whom I'm speaking regularly, and I'm sharing my views, like, this is how I feel. And my husband as well, obviously, because I'm here with him for 24 hours. So it is important. It is important, even as a doctor, even as a human being, no matter what side of where you are standing, whether you are standing at a receiving end or at a giving end, to share your feeling, to share your emotion, how you feel like. Even as a doctor, it's important for you to say that, I don't feel okay with that. I don't. I'm feeling traumatized, and a lot of I have seen even in the healthcare professionals having that post-traumatic stress disorder after seeing so many deaths in the hospital. And it's not easy. We all are equally vulnerable. But the only thing, CK, which can prevent us is being open, being honest about our feeling, being very clear and concise in terms of our thought process, even when we are giving any sort of message to the patient, being very, very clear what is the situation, how the things are, making them realize that this is the realistic thing on the ground right now. This is how the things are going. And once we have that kind of trust, mutual respect, and a clear message exchange between the two parties, I think a lot of things can be prevented. But the first and the most important thing for any healthcare professional, I would say, is please don't ignore your mental well being. And that is very important, because if you are mentally strong, which is very, very hard in this current situation to maintain, please be open, please share it with somebody whom you are close. And if you think you're still struggling, get a right help, because there are a lot of people, there are specialists, there are psychotherapists, there are psychiatrists as well. There's a lot of people who are there around you, or maybe your parents, maybe somebody whom you're close to, maybe your partner, maybe your close friend. But just share your feeling. Don't just keep that negative feelings to accumulate within yourself, which will impact your mental well-being. And I think this is the hour of the need, that we have to be careful about our mental well-being, at the same time not losing our hope, having a positive attitude in life, and spreading the right cause. This is what I feel, CK, that can prevent many tragedies in future.
Absolutely, Nehaji. In fact, I think we can expect a lot from the medical, industry, especially doctors. We sometimes feel that doctors can do wonders, but we do not, we do not remember. Their end of the day, they are also one of us. They are also humans. They are also affected by emotions. So my appeal to everyone today, because these are trying times, we must develop patience, and some of the guidance that the Dr. Neha Sharma has given to fellow doctors, I think that is applicable for everyone. We must calm down, take the whatever wrong is going on in a positive stride, trying to make sure that we don't overshoot our emotions and vent it out on medical professionals or doctors. I think that is my learning from you after talking to you, Neha.
Thank you. I think God has given us one mouth, CK, and two ears. So that is for a reason. We have to listen first, we have to hear more, and we have to speak less. But at the same time, there is a difference between when we say that somebody is a talented communicator and somebody says that he's a very effective communicator. There's a difference between a talented and effective. Okay. And the main difference is an effective communicator is the one who is trustworthy, who is empathetic, who is a good listener, who understand and who believes in resolving the conflict rather than actually supporting the conflict. So if these things are there in any of the individual, I think a lot of things can be changed.
Absolutely. I think we are still reeling over the pandemic, and it's not over yet. I think we will discuss this subject once more again in future sometime, and also much more interesting subjects with you in the programs which are going to come in future. So for today, I'd like to say goodbye.
Thank you. Thank you, CK. Pleasure is absolutely mine.
Bye bye.
Right.